Hello, candidates. This is the webinar for the written exam. I'm going to go through the PowerPoint that is available to you on the homepage of the www.acnb.org website. And in the process, I'm also going to show you the documents and go over them a little bit and then go over some extra information that people have already been asking. So I'm going to start with the PowerPoint and then we'll slip in and out of the different aspects of it. By the way, I am Dr. Lucinda Harmon, the person you've been getting lots of emails from. You're to go to www.acnb.org homepage and look at the corner of the document. Look at the right-hand corner. You can see here, I'm on www. Here's the homepage. And you scroll down and it says Attention Diplomates and Candidates. Diplomates first and then candidates. Helpful candidate documents. And you can tell the registration has already ended. And you can see all of the various documents that you need to be able to get to. By the way, if you're going to ask for extra time, there is the link for your extra time on the exam, and you need to do this immediately. So now you can find that one. The written blueprints is the next part that we're going to discuss. That's your first essential document. And this explains how the test was developed, provides you with percentages of each of the areas for neurological system and percentages for the major work areas. Be sure that you study utilizing these documents. This is the first set of them. This is your written blueprint. And it looks like this to start with. Professional written exam blueprint. Tells you that it's what it's referred to and where it was developed and how it was developed. Tells you what the purpose of the exam is, your background and experience that you have to have in order to be eligible for the test. You all already know that. You've already been submitting documents to me. And now the written exam blueprint. The neuron theory will have 5.50%. If you really want to get specific and calculate out the actual number of items, it's 450 items total, so 5.50% times 450. Receptor systems, 4.84%. Peripheral nerves, 5.30%. Spinal cord, 5.40%. Brainstem, 5.76%. And brainstem is not combined cranial nerve brainstem, it's separated. Cranial nerves, 5.87%. Head and face, 6.61%. Cerebellum, 6.43%. Basal ganglia, 6.56%. And by the way, that's head and face pain. Basal ganglia, 6.56%. Reflexogenic systems, 6.56%. Autonomic nervous system, 6.64%. Limbic system, 5.25%. Lobes of the brain, 6.42%. Brain and its environment, 5.73%. Neuroendocrine system, 4.12%. Pain, 6.51%. Red flag issues, 4.51%. All items are weighted 1 point each. They're all equally weighted out of the whole 450. The work activities, history, 3.73%. Physical exam, 7.66%. Special studies, 9.22%. Diagnosis, disease processes, metabolic rate, pathways, 42.60%. Treatment, rehabilitation, including anatomy and physiology pertinent to treatment, metabolic rate if it's very specific to the treatment. Those are the types of issues that will be there, and that's 34.99%. Referral, 1.80%. So you can tell that a lot of weight is put into diagnosing, and that's because there's several levels of diagnosing, and if you cannot diagnose and determine the level of lesion, you're not going to be able to treat. Ethics is 2%. That is the written blueprint in a summary table. Let's go back into our PowerPoint now. All of the longer cases, the exam is developed in 3 parts because it's too long to do in one. The first part of every one of the portions is a set of cases, approximately 15 cases, and they have questions that are attached to that case that have you use the history and physical exam information in the case to be able to answer the questions that follow. You will be able to flip back and forth on the computer to see your cases, and it's one click over, one click back to the items. You're going to need to get familiar with this template, and I'm going to show it to you now. Because every one of the more complicated cases will be written in exactly this format. Goes through the history, the chief complaint and present illness, pain history or complaint history, family history, social history, past medical history and review of systems, physical exam, general appearance, vitals, goes through all of the vitals that you'll need for that one, mental status, cranial nerves, sensation, motor, including tone, strength, and reflexes, coordination, balance, and imaging and special studies. In order to minimize the amount of time you have to spend reading, because it is considerable, if there is a finding that is within normal limits or non-contributory, you will be told it is within normal limits. So don't worry about it. Just keep plugging along. The tools and modalities are going to assist you in knowing what types of tools and special studies, what types of treatment modalities might be used on the test. It's only an overview. It is not an exhaustive list. The risk factors listed here are for the risk of treatment or risk for history or illness, such as occupational risk is football for head injuries, knee injuries, ice skaters that spin one direction all the time and crash their brains that way. Anyway, I'm going to show you the tools and modalities now. These are not exhaustive. This is just illustrative. And you can see what they all are. You have access to this document. And one of the things I do want to remind you about, a lot of you know this and some people are confused about it, and I've had several questions. When you do colored lenses for glasses, you need to be sure to remember that to determine what color of lens you get, you're looking at the light spectrum, and red lenses cut out more of the light spectrum, red or rose colored cut out more of the light spectrum than do the blue, green, or purples. But blue, green, and purple cut out clear, cut out some of the light spectrum in the white or the clear spectrum. So it's always relative to what you're doing. If you're going to you want to calm down somebody's IML, you're going to look at red on one side and you want the other side to activate, and you're either going to go rose colored or you may go clear on the side that you want to activate instead of to cool down or to decrease the amount of stimulation. So just be sure that you're realizing this is light spectrum and it's how much light is kept out by the lens, which is acting as a filter. And that may be oversimplification for many of you, but I've had some questions on it. Okay, back to the PowerPoint. The practice test. The practice test is a really, really good way of showing you how to go through the exam. It's going to give you a good idea of what the cases are written like, how the multiple choice questions are formulated, and there will be some multiple choice questions. And I really recommend that you time yourself when you do this exam, because if it takes you more than 20 minutes, you're going to need more time on the test than the 4 hours allotted. It is 1 hour extra for each of the first 3 parts is $100. That's for all 3 hours. Just because they're divided into 3 exams doesn't mean you have to pay $100 per part. It's basically $33.33 a part. And if you need 2 hours extra, if you've got reading disability, English as a second language, don't shortchange yourself. You've already paid a lot for this test, and we get charged that money or we wouldn't be charging it to you. So I really recommend if you need that, you go ahead and pay for it and ask for it, but you better ask for it very quickly because it does make a difference in what kind of proctored site you're going to be able to access. They fill up quickly, so you guys need to get on this rapidly. I think you've all received your letters from ISO Quality Testing to schedule your proctored sites. Get on that and get on it quickly, especially if you're in a rural area. Even if you're in an urban area and there are a lot of you there, you need to get on this and get going with it. If you live far out, you need to negotiate. You need to establish a relationship with the people at ISO Quality Testing so that they might be able to locate you another testing location closer to you. But you have to interact with them. I can't do that. I don't have the power to do it, and it's not going to work for me to be the go-between. So you're going to have to do that yourselves. You must request this well before you register, i.e. now. Preferably before the exam. Do this before July the 1st. And I'm probably not going to do a PowerPoint on this because I've already done, you've already gotten your letters. Primary references. You've got a whole list of primary references. And I really recommend that you use those. Again, they're on the home page of the document. And they're critical that you utilize these because we use these to actually reference the documents. And I've shown you that in the last webinar, so I'm really not going to go over that much. Now then, the most important part of the study guide, of this information, other than all of these different documents, is the study guide itself. And I am going to go over that fairly thoroughly with you this morning. So I'm going to get out of the PowerPoint right now and just go directly into that study guide. I will go ahead and show you the practice test. Here's the practice test. This is just to look at it. You see the cases. You see the physical exam. Goes through all of those different aspects, and then questions. This is what we call a complex multiple choice or a multiple. You see it's got 1, 2, 3, 4, 5 possibilities, and then your answers are actually combinations of those. This is a simple multiple choice question. And as you can see, when you get a question, you're going to find that if you think it's myasthenia gravis or Charcot-Marie-Tooth, whichever one you think it is, you're going to find answers all the way through that would agree with whichever one of these you choose. You're going to find that. We've worked really, really hard at not giving away the answers in further questions. There's a second case. These are retired cases. You won't see these on the test. And again, a multiple, and then single items. And then a third case. So you see, I'm expecting you to be able to do 3 cases in 20 minutes. And if you cannot, 28 items, if you cannot do that, time yourself. Ask for the extra time. You will not regret having asked for the extra time, especially if you run out of time. Okay, I'm going to close that out now. And we're going to go on and look at this just briefly at the references. And this is a pretty small version to see on the website, on my desktop, but I've just enlarged it a bit. Encephalography, you're going to need to know that basically from the atlas point of view. It really does help with a lot of the cortical information. De Jong's neurological exam, you need that for both the performance and the written exam. Clinical Neuroscience Course Companion by Dr. Carrick. If you haven't gotten those, and you can, you need to. Technique of the Neurological Examination. Anything that we ask you about in terms of examination is going to be from one of these two books, because we use it. Or Patent for differential. And we do use Bates or Moody for just general examination techniques, but that's mostly in the practical. We don't do a whole lot of that in the written exam. The Principles of Neuroscience. Kendall, Schwartz, and Jessel use the newest edition. The information hasn't changed a whole lot, but it's kind of silly to buy an old edition if you're going to purchase it, and I personally purchased it. I think it's an excellent book. Nolte's The Human Brain. It's a great introduction to the brain, its functional anatomy, and you can track your pathways that way and just clarify something using a little bit of right brain technique in that. In fact, I do recommend also that you use any of those coloring books, because they give you a little bit more right brain function while you're studying your neuro. The Neurological Differential Diagnosis, Preston Shapiro, Electromyography and Neuromuscular Disorders. You need to have an overview basis for that. Mostly what we teach in this part of it, and what has been taught and what we test over, is, do you know when to ask for that as a special study? Do you know what it's measuring? Do you know its importance? And do you know how to read one of those studies that's sent back to you from a consultant? Epilepsy. The epilepsy in the 100 elementary principles. We don't test a whole lot on epilepsy, but it can also give you some good information, just overall information about the brain. We do a little bit, but there's not a whole lot in that. Stroke, you need to know. Then the two neurologic exams are mostly for the practical exam. This is not an exhaustive reference list. There are a lot more books out there. Many of them are extremely valuable. This is just the primary reference list. And now the study guide. This is the real in-depth material. Looks like this. And if you haven't already picked it up, you need to get to it. It goes through, and we've divided it first into anatomy and physiology, indications of what is important, what the job analysis determined what was important, and it goes through every one of those areas. Diagnosis and disorders, it goes through every one of those areas. Diagnostic issues, talks about the various issues that are important. Treatment and rehabilitation. Special studies. As you can see, this is a very comprehensive study guide. Goes through on the neuron, theory of the neuron. Cell wall, nucleus, mitochondria, axons, and sorry about some of the spelling errors. I am a dyslexic, and I am the one who typed this, so forgive me. Anatomy and physiology of the receptors. Peripheral nerve, anatomy and physiology. Spinal cord. If it's in here, you're responsible for it. Brainstem. Cranial nerve. Physiology of the cranial nerves. Head and face pain. Cerebellum. Functional cerebellum. Basal ganglia. Reflexogenic systems. So you notice the brain is a pretty integrated organ, and you're not going to be able to tease out just one tiny little part that's affected. And that's good, because if we could do that, then basically there wouldn't be a whole lot of need for us, because we wouldn't have all the pathways in order to activate and help with the homologous columns and fixing things, and causing the brain to fix itself. An autonomic nervous system. You can see the complexity of this. The limbic system. Lobes of the brain. Need to know those. They're very important. Brain and its environment. You notice in here, the brain and its environment, you've got a lot of arteries going on. You need to know your arteries. Neuroendocrine. Pain. Now you get into disorders and diagnoses. The red flag scope of practice issues. Meningitis, increased intracranial pressure, blood pressure that's way too bad. You know, diastolic of 110, systolic of 180. Your person's really in trouble. Blood pressure, diastolic of 50 or below and 80 or below. Heart rate rhythm, all of those things. Cauda equina. Cavernous sinus, subarachnoid hemorrhage, blood sugar non-fasting below 50, blood sugar non-fasting above 300, with diaphoresis and lowered level of alertness, sepsis, emergent stroke, respirations below 7 or above 20, or in a known patient, plus or minus either direction at rest with altered breath sounds, visual field defect, temperature problems, projectile vomiting. I'm back again. Sorry about the interruption. We're back looking at peripheral nerve disorders. You've got motor root lesions, sensory root lesions, combined, compressive, trauma, lumbosacral, entrapments, all of those different things. Disorders in the spinal cord. Talks about all the different spinal cord lesions. Brainstem. And the things that did not achieve a certain level of significance in the study, a certain level of value from the study guide, from the job analysis, did not get included in here because they won't be on the test. All of this could be on the test because it did reach the level of significance. Cranial nerve, tumors, vasculatures, trauma, infection, congenital, plasticity and deafferentation, hemisphericity, macular degeneration, reflective afferent papillary defect, nerve palsies, disorders of the head and face, pain, migraine, cluster headaches, cervicogenic, tension-type headaches, temporal neuritis, subarachnoid hemorrhage, trigeminal neuralgia, atypical face pain, temporal mandibular joint pain, disease processes of the cerebellum, atrophy, injury, toxicity, genetic diseases, concomitant deafferentation, pathway disease, spinocerebellar, tumor, stroke, ischemia, location, tremors and symptoms, diagnosis and diseases of the basal ganglia, movement disorders, Parkinson's, Huntington's, Melismus, Tourette's, obsessive-compulsive dystonia, Wilson's disease. Disease, reflexogenic, tumor, vasculature, deafferentation, genetic, toxicity, hemisphericity. And you notice that a lot of these are going to override. They're going to overlap each other. Autonomic nervous system, sympathetic escape, Raynaud's, complex regional pain, sympathetic aggravation, Horner syndrome. Limbic system, depression, anxiety, autonomic dysregulation, emotional manifestations or lack thereof. Neurodegenerative disorders, neurodevelopmental disorders, dysautonomia. Lobes of the brain, boy there's a lot. Functional categories, attention, emotion, memory, sensory motor integration, movement execution, interhemispheric disconnection, dementia. Anatomic categories, occipital, temporal, parietal, frontal, and callosal. Terminology, neglect, akinesia, perseveration, echolalia, akinetic, hallucinations, agnosia, alexia, dysgraphia, aphasia, anomia, apraxia, acalculia, palsy, and hemianopia. Now you know I'm not going to let a question get in that says just define hallucinations. You're going to have to know what they mean in order to know what you're treating and where it's located in the brain and how then you do a modality to address it. You may have symptoms and have to identify what the problem is and what part of the brain it's located in. Disease brain processes, brain and its environment, stroke, ischemic attack, aneurysms, malformations, meningitis, encephalitis, leakage of CSF, increased intracranial pressure, and cavernous sinus syndrome or thrombosis. Neuroendocrine, you've got a lot of these too. Hypothyroid, you've got pituitary, you've got thalamus, you've got panhypopituitarism, growth hormone issues, dwarfism, thyrotropin, pituitary TSH, all of those, deficiencies in vasopressive. Look how long this list is. That's because the endocrine system is very complicated and it interacts over a lot of different areas. Know these things. You need to really look at them. Look at the diseases of the adrenal cortex. A lot of stuff like that's going on in our world today. Pheochromocytoma, diabetes mellitus, very huge today. Abnormalities in testicular function, abnormalities in the ovaries, disorders affecting multiple endocrine systems. Pain, complex regional pain, neurogenic inflammation, chronic pain associated with decreased brainstem, chronic pain associated with decreased internuclear function, hypoxic nociceptive depolarization, neuropathic pain, fibromyalgia, labor pain, post-surgical acute pain, cancer-related pain, arthritic pain, rheumatoid, osteo, muscle pain, spasms, pull, and tear. Diagnostic issues relevant to each area. So, what are the issues? History taking, neurological exam, visual acuity, auditory, basic smell testing and taste testing. Sorry, that's not capitalized. Differential for peripheral versus central vertigo, Romberg's, Dix-Hall-Pike maneuver, interpretation of the special testings, assessments of the muscle tone, assessments of cutaneous modalities. You get the idea. These things are really well covered. You need this document because I can pretty much guarantee you that if it is not somewhere on this document indicated in some way, then it won't be on the test. If it is on this document, you're very likely going to see it on the test. Remember, we got 450 items and approximately 45 cases, and then a lot of single issue items. So, this is what's there, and you need to know this document thoroughly. Now then, I'm going to look at another part, which is our website, and I want to show you under the who we serve. You don't even have to log in for this. Who we serve, candidates, and important facts for candidates. You need to go over this. You're going to have some questions, and before you send me an email asking me the questions, I want you to be sure it's not already on this facts list. Because you've got, what study material does the board provide for the candidates? Well, I've just shown you most of it. And it gives you all of this again. I speak English as my second language. Can I get an accommodation in time for the exams? It's written down here. It's even calculated out as to how we charge for it and what you need to do in order to get it. You can even write a check to the ACNB and mail it if you can't get the website to work for you. Do we get a copy of the physical exam? We've already gone over that for the practical. This is for the other one. Video clips, again, we've gone over that. I've paid my fee, but I'm unable to take the test. Can I transfer it to next year? Only reason the board will transfer is if you or your family member has a major illness or death or major emergency. We do require documentation of such an incident to transfer the fee. Overextension of your time commitments and failure to plan the study time does not qualify, nor does it qualify for other reasons along that line. If you just didn't plan well, we can't do anything about that because we have to expend the money that you pay for the test in order to develop the test and all of these other issues. So you can request it and it will go to the full board, but they don't violate the policy. I read slowly. Can I get extra time? Yes. And again, it tells you that you could get the time. And it's, look back up there at the I speak English as a second language for the calculations in case you're confused. You won't pay more than $200 total. Trick questions. The ACNB does not attempt to trick you with items. If a word is misspelled, it's either a country variation in spelling or a human error. The exam goes through several people to minimize these errors, but every once in a while, one slips through. We don't trick you with spelling errors. If it is misspelled, it's just a mistake, and we're sorry. We don't try to hit you with trick terms. Treatment modalities. There's no way that every possible treatment can be on the exam. There's no way we can do that in a multiple choice test. So when answering the items, look for the treatments listed and choose the best possible option for treating the level of the lesion or the concomitant lesion. Be sure you read the question to determine exactly what type of treatment you're looking for. Also, each chiropractic college uses different adjustment techniques. We try to be descriptive of the adjustment process without referring to specific techniques, but we do use the word coupled adjustment because Dr. Carrick does. So you do need to know what that means and how it activates the various neuron pools and pathways. You can probably think up 10 different ways to treat somebody that may be better than all of them on the test, but you don't have that option. Look at what's offered on the test and choose the best option offered. We know there are more ways than what we list, but you're restricted to what we're listing because we want to know that you know how to activate those neuron pools and you know what those treatment modalities are. Some multiple choice test taking tips. In the ACNB's written exam, the non-case related items are at the end of each part of the test. If you're kind of getting freaky when you first walk in there, you may want to skip to the beyond the case items and just answer those plain ones first to get your feet under you. We don't care. It doesn't matter. You can then go back to the first of the test and start and do the case related ones. You are able to do them first. If you're concerned about time, I would suggest you do. It's a lot of points there. The case-related items, approximately 15 cases per part of the exam, so you'll get about 15 cases a day, which adds up to 45 cases. It's very like a hectic week in the office, or in the beginning of each part. We've worked hard to avoid giving away the correct answer by an item or question further in the case, so don't waste time looking for that. Do not second guess yourself. Your first instinct is usually correct. When people get anxious, they tend to overthink and change answers. We're not trying to trick you, just to assure that you know your information and that you're minimally qualified. Trust yourself and your training. Be sure to take care of your brain and not discuss the test and ruminate on it between the parts. Your brain needs to refresh itself, and discussions of this sort can A, lead somebody else astray, cause you to panic, and really wear your brain out. Go do something enjoyable, right-brained, and non-neuro between your parts of the exam. I don't recommend alcohol. The ACNB multiple choice written exam does not penalize for guessing. So even if you do not know the answer, do the best you can. We only count what is correct and do not deduct for incorrect. This sounds confusing. Some tests count the correct answers then deduct a certain percentage for those answered wrong. They ignore blanks. We do not do this. We only count the correct items and view the incorrect and blank as the same, i.e. no credit. So you should guess, especially if you can eliminate one or two of the possible answers. And here it is with reading disabilities or brain injuries. Just because you're a doctor does not mean that you cannot have reading difficulties or a brain injury. If you have such difficulties, contact me, Dr. Harmon, to arrange reasonable accommodations for your testing. Harmon, Harmanl @me.com. Do not let pride get in your way. Do not do that. Every one of us is a human being with strengths and weaknesses. You are too. You are human. So don't let pride get in the way of your asking for an accommodation. It has nothing to do with your competency. It just means you need extra time. That is pretty much all I've got for you. If you have any questions that are not answered here, feel free to email me and ask me the question. I'll collect a set and I will send them out to you, much as I did the practical exam. And you will be able to get your answers that way. And don't ever be embarrassed about asking a question once you've looked at this webinar, looked over your documents, and looked at your questions. Then feel free to ask me anything you need to ask me. And study hard. I'm looking forward to adding many, many, many of you to our Diplomate registry. We need you guys. I can't tell you how many times in some areas that I have to tell people, I'm sorry, you're going to have to travel 500 or 1,000 miles to get to a diplomate. So, have a good day, have a good study period, and the exam starts August 1st. Be sure you have registered through ISO quality testing, and if you have not received your letter, get in touch with me. They have all been sent out, and I have copies of them. You may want to check your spam folders to be sure you have not eliminated the possibility that they can get through to you. It's ISO qualitytesting.com. So you need to be sure you can get those through your spam filter. Thank you very much. Bye-bye.